I'm Dr. Bentley, an internal medicine and gastroenterology specialist. So how can I help you today?
Hi, Dr. Bentley. I'm Sarah, I'm 32, and I work as a marketing executive. I've been dealing with really bad heartburn for months now, and it's starting to affect my sleep and work. I'm taking antacids constantly, but they're not helping much anymore.
Chronic heartburn can significantly impact quality of life. Can you tell me more about when you experience these symptoms? Is it related to meals, lying down, or certain times of day?
It's worst after eating, especially dinner, and when I lie down at night. Sometimes I wake up with a sour taste in my mouth and my throat burning. I'm getting hoarse more often during presentations at work.
Those symptoms suggest you might be dealing with GERD, gastroesophageal reflux disease. The hoarseness is particularly telling because it indicates acid is reaching your throat and voice box. Not necessarily. Many people can eventually reduce or stop medication with consistent lifestyle changes. However, some people do need long-term treatment, particularly if they have severe esophagitis or Barrett's esophagus. We'll start you on a PPI to heal any existing inflammation, then work on lifestyle modifications. The goal is to use the minimum effective treatment.
You mentioned testing earlier. What kind of tests might I need?
If your symptoms don't improve with treatment, or if you have concerning symptoms like difficulty swallowing, unintended weight loss, or persistent hoarseness, I might recommend an upper endoscopy. This involves a thin, flexible tube with a camera to directly visualize your esophagus and stomach. It can detect inflammation, ulcers, Barrett's esophagus, or other complications.
Are there any immediate changes I can make to feel better?
Absolutely. Start with smaller, more frequent meals instead of large dinners. Try to finish eating at least 3 hours before bedtime. If you must have coffee, limit it to 1 cup in the morning and consider lower acid varieties or cold brew, which is less acidic. Prop up the head of your bed 6 to 8 inches using blocks or a wedge pillow. Extra pillows alone won't work effectively.
How quickly should I expect to see improvement?
With PPIs, most people notice significant improvement within 2 to 4 weeks, though complete healing of esophagitis can take 8 to 12 weeks. Lifestyle changes may take longer to show full benefit but often provide some relief within days to weeks. The key is consistency with both approaches.
Thank you so much, Dr. Bentley. I feel much more hopeful about managing this now.
What types of foods seem to trigger your symptoms most?
Coffee definitely makes it worse, which is a problem because I drink a lot of it at work. Spicy foods, wine with dinner, and late-night eating seem to trigger it too. My job involves a lot of client dinners and stress, so my eating schedule is pretty erratic.
Your lifestyle factors are definitely contributing to your symptoms. GERD occurs when stomach acid flows back up into your esophagus. Stress, irregular eating, caffeine, alcohol, and lying down soon after eating can all worsen this condition.
Is this dangerous? I've read online about cancer risks, which has me really worried.
While GERD itself isn't immediately dangerous, chronic acid exposure can lead to complications if left untreated. These include esophageal inflammation, ulcers, strictures that can cause difficulty swallowing, and in rare cases, changes in the esophageal lining. The good news is that proper treatment can prevent these complications.
What kind of treatment options do I have? I really can't give up coffee completely with my job demands.
We have several effective approaches. First, lifestyle modifications, eating smaller meals, avoiding trigger foods when possible, not lying down for 3 hours after eating, and elevating the head of your bed. For medications, proton pump inhibitors like omeprazole are much more effective than antacids for frequent symptoms.
Please leave a comment below.
Will I need to take medication forever?
Not necessarily. Many people can eventually reduce or stop medication with consistent lifestyle changes. However, some people do need long-term treatment. We'll start you on medication to heal any existing inflammation, then work on lifestyle modifications.
Are there any immediate changes I can make to feel better?
Absolutely. Start with smaller, more frequent meals instead of large dinners. Try to finish eating at least 3 hours before bedtime, reduce coffee to 1 cup in the morning if possible, and prop up the head of your bed 6 to 8 inches.
Can you be more specific about which foods to avoid? And why does lying down make it worse?
Certainly. The biggest culprits are fatty and fried foods, which slow stomach emptying and relax the sphincter. Citrus fruits, tomatoes, chocolate, mint, onions, and garlic are common triggers. Spicy foods don't cause GERD but can irritate an already inflamed esophagus. Carbonated beverages increase stomach pressure. As for lying down, gravity normally helps keep stomach contents down. When you're horizontal, especially soon after eating, it's much easier for acid to flow backward into your esophagus. Thanks.
Remember, this information is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for personalized medical care.